Hello and welcome to our special show, Coronavirus, Facts versus Myths. I'm Gargi Rawat. This is a show where we get you all the latest on the pandemic, also the latest vaccine news as well. Let's now take a look at the headlines we're tracking. As the centre pushes the vaccine drive, India has crossed the million mark. Over 10 lakh people have been inoculated so far. On Thursday, a record 2,37,000 vaccinated. President Joe Biden has signed a raft of executive orders to boost the fight against COVID, which has ravaged the United States. U.S. infectious disease expert Dr. Fauci says it's liberating to work with a new team on COVID. He says science comes first. And as UK sees an increase in the number of COVID cases and the number of deaths, they've increased the fine for those breaching the lockdown rules. Well, up first, let's get to the latest COVID numbers. In India, recorded 14,545 fresh cases of coronavirus and 163 deaths between Thursday and Friday morning, according to the data released by the Ministry of Health, which has pushed the country's caseload to over 10.62 million. Now, the number of COVID cases is lower than those recorded on Thursday morning, which was 15,223. And there you can see India's case graph, how it peaked and how it is coming down rather steadily there. Now, the other good news is that India has crossed the 1 million mark when it comes to the vaccinations. This is on day 6 of the vaccination drive. The Health Ministry has said that 10,43,534 health workers have been vaccinated so far, and that on Thursday there was a record number of doses. That's 2,37,050 doses. So the numbers reported on Thursday are the highest in a single day, over 2 lakh doses being reported on that day, and this is after the launch of the vaccination drive on the 16th. Now, India is now the fastest country to have breached that million mark, taking only 6 days compared to 9 by the United States, according to data from University of Oxford's Our World in Data. Now, this even as there have been worries over the vaccine hesitancy that has also been seen in different parts of the country. Well, to talk more about India's vaccination drive, we're now joined by Dr. Yatin Mehta, Chairman, Medanta Institute of Critical Care, and Dr. Mahesh Lakh, Internal Medicine and Infectious Disease, Columbia Asia Hospital in Pune. Thank you both, doctors, for joining us. First to you, Dr. Yatin Mehta. Great news today that we've crossed 1 million vaccine doses across the country, and it seems that it's now picking up the vaccine drive. I believe you've been vaccinated as well. Tell us about your experience.
Well, absolutely pain-free. I had a jab. The needle is very sharp, but it's not at all painful. I was a little sore at the arm, and I had a bit of headache in the evening, which went away on its own. I didn't even take a crocin. So I had no fever, no body ache, nothing at all. I was immediately after my jab, I sat for 30 minutes, which is the prescribed time for observation for any adverse events. They were none. So I went back to my work. I worked through the day. Absolutely no problem.
All right, and what is your opinion on this vaccine hesitancy that has been seen? The good news, as I said, is that it does seem to now be picking up. Over 2 lakh people vaccinated just yesterday. It seems more and more are coming forward, and the government has also been giving a big push to create more confidence in the vaccines.
See, Gargi, there were apprehensions initially, and there was some hesitancy, which is still there, because of have been in India measure.
All right, sir, we seem to be having a bit of a problem with your audio. We'll just try and get back to you. We have Dr. Mahesh Lakh as well. And Dr. Lakh, what do you have to say about, this vaccine hesitancy we've been seeing? Yesterday, the announcement, or rather a source-based information came that the Prime Minister would be vaccinated in the second phase of the vaccinations. And today, the the Health Minister also spoke out about the vaccination drive and said the vaccines are safe. So all this now working, and we're seeing the results with more and more coming forward for the vaccine.
Yes. See, basically in our country, overall there is a hesitancy about adult vaccination. So I have been infectious disease consultant, and we have been running this adult vaccination outpatient clinic at least once a week. And I have seen that, we have overall hesitancy for adults to take vaccines as such. Whenever it comes to vaccines, people always think about kids. But on the contrary, in the Western world, you might have seen that people queue up for taking these flu shots annually. And that is why this is nothing new as such, especially for COVID, I feel. But as the number of people who are taking vaccines, if people see people around them are taking vaccines and they are pretty safely going to their regular life with a safe antibodies in their body. So I think, as the day will pass, people are definitely going to take these vaccines more and more in number. And apart from that, minor side effects like injection site pain and some amount of fever or some nausea here and there. These are the minor side effects most commonly seen. But, most of the times you need not to do anything. Means, within 12 to 24 hours, you are going to be well. You will not have any lingering effects of this vaccine as such.
Right, and Doctor, what's been surprising is this is, the first phase in which the 3 crore people who are to be vaccinated in the first phase are health workers and, frontline workers. And we're seeing hesitancy among them. So even among the doctors and nurses and, healthcare workers, they have this wait and watch attitude.
Yeah, agreed. But when I've been talking to some of my colleagues, especially in Maharashtra, in rural parts of Maharashtra, most of the times, they didn't get the intimation like SMS or call from the authorities. And I heard, or I have been told that there have been some glitches in the app, which is made for contacting these people who have been registered. But I think that has been taken care of, and now people are getting those intimations to take their vaccines at the earliest, at the nearest center where they have been registered, and that's how they are going to take these vaccines.
Right, and Doctor, another point that is being raised by many people is about the number of cases in India. And if we could just show that curve, India's cases have come down significantly, being under 20,000 over the last so many days. And so many people now even questioning that given that the cases are coming down in this manner, do we really need the vaccine, which is also a very dangerous way of thinking. What's your response to that?
Exactly. See, overall in our country, and for that matter in most of the countries in Southeast Asia, we have been lucky and not, have too many cases if you compare them with the European countries or United States for that matter. I think, the study published by Dr. Rajiv Mande and researchers from the Cellular Biology Institute in Pune, they have said that we have been immune trained. Basically, because of the lot of parasitic infections and other epidemics which we see in our country in the past. And that's how we have been immune trained. And that is, in fact, a good news, basically, because we have been not having too much of severe disease and all. But having said that, we should not be relying on that kind of thing for too much time, because in other countries, as you have seen, there have been second waves which have come, especially after starting the schools and opening up the lot of other business activities. They have seen surge in the cases. So, but we are lucky that even before that second wave hits us, we have the vaccine available with us. And I recommend, and most of our colleagues, like scientists, community, have recommended that it is quite safe and people should go and take the vaccine because it is harmless. I have been in adult vaccination in the last 10 years and I do a lot of adult vaccination. Always people have this hesitancy, but once you talk to them and tell them about the pros and cons, I'm sure a lot of people will take this vaccine at the earliest.
Right, Dr. Yatin Mehta back with us. Dr. Mehta, we were just discussing how this is just the first phase of the vaccination, and those getting vaccinated are, healthcare workers, frontline workers, and we're seeing hesitancy among them. But hopefully it is picking up. And, a lot of you doctors, senior doctors who are seen as mentors going ahead and getting the vaccine. Also important that, that news came out yesterday, the Prime Minister will be getting the vaccine in the second phase. And that hopefully when the second phase does take place, that will encourage more people to come forward.
No, that is true, but as to lead from the front, so it makes sense in the second phase for the PM and the CMs to take the shot. And we all have taken, Vedanta has 90% of the healthcare workers have taken their vaccine when their turn has come. Absolutely, let me reassure everybody, the side effects are minimal, and there are no problem with the 10 million cases, 1 million which have, and the incidence is very mild. So mostly headache and fever and some pain in the joints, and it disappears within a day if you take crocin. So let me reassure everybody must take vaccine, because herd immunity is what is going to protect us. So far we have managed the situation and crisis quite well, but if we take vaccination, then we will be protected the next year also. So I think everybody must take vaccine unless there is a medical reason not to take the vaccine.
All right. Well, we have many questions that our viewers have sent us. Let's just listen into the first question.
Hello everyone, my name is Manvi sir. My question is, I have heard of you take the vaccine, you can still get infected. What does it mean?
Right. Dr. Mehta, first to you.
There is a small possibility that you may still get infected, but the main thing is it will protect you against seriousness of the disease. So even if you are the unlucky one to get the disease, to get the COVID infection after getting vaccinated, your disease would be mild and you'll be managed at home nicely without any problems. It will not progress to severe disease, which will require hospitalization or ICU admission. So still it is worth taking the vaccine, and no vaccine gives 100% immunity against any disease.
Right. And Dr. Lakh, that does mean even after vaccination, as all you doctors have been saying, you have to continue with the, with the COVID protocols in terms of masks and, distancing, because you could still carry that infection and spread it.
Yeah, exactly. So the question is, do the vaccine prevent transmission of the virus to others? And there are several good reasons to be optimistic about the vaccine's efficacy on disease transmission as well. So not only it is going to, prevent the disease, severe disease for you, but there are good reasons to be optimistic that this vaccine is going to prevent the transmission. The important thing is, from population-based studies now, that suggest that people without symptoms are less likely to transmit the virus to others. The second is, many of the vaccines in wide use powerfully protect against both diseases and transmission, so much so that infection control is one of the main motivators behind some vaccine policies. And of course, right. The study, Moderna trial, which has shown us that participants who underwent, PCR testing at the baseline and again at the 4 weeks after taking the shots when they have come to, for the second dose, it has been seen that the placebo group had test positivity 0.3% of 1273 volunteers, while people who have taken even single dose, they have positive rate of 0.1. So it clearly shows that if you take the vaccine, even
the vaccine,
shot, it is coming down. The transmission is
right.
coming down. So that is why all the way important to even cut down the transmission of the disease. Not only it protects you from a severe disease up to 19 to 95%, and from mild disease up to 70-80%, but the transmission rate is going to go down. That is how it is important for public health perspective.
All right, we have one more question. Let's just listen in.
Hello, doctor. Myself, Shubh Trivedi. I have a question for you. Has the effect of coronavirus become less because now hear of lesser people being hospitalized or suffering?
Right, Dr. Mehta, this is also something we were just discussing earlier with Dr. Lakh, that, a lot of people feel that the effect has become less. You hear less about the cases and hospitalizations.
No, that is true. Actually, all over India, in all parts of India, the number of hospitalized patients is going down. And even in my ICUs, the number of patients has significantly gone down. Not only that, I find now the mortality has gone down, the severity has also gone down. So part of it may be because less patients, people who are getting the disease will get to severity because of the certain degree of herd immunity which is already happening. Or the virus has mutated, I can't say. But yes, something is working. And let me tell people that there is a light at the end of the tunnel. Incidence is going down.
All right. Well, thank you so much, doctors, for joining us on the show today. Dr. Mehta and Dr. Lakh, thank you for joining us.
Thank
Well,
you.
news
Thank
now
you.
from Germany. And Germany, once the poster child of the pandemic response, can't seem to get the virus under control after months of increasingly harsh shutdown measures. The country is now doubling down on the virus. For more on this, we're joined from Berlin by DW's Nicole. Nicole, thanks so much for joining us. And do tell us about these tough measures, tougher measures, in fact, in Germany now. But for some people, they're not going far enough, are they?
That's exactly right. Even though yesterday state and federal leaders decided on extending the current shutdown until at least mid-February, a stricter mask mandate on public transport and an obligation for employers to allow workers to carry out their tasks from home if possible, there is a very vocal fraction of society demanding more drastic measures. Leading scientists in the country are asking the government to opt for a pan-European no-COVID approach, akin to the zero-COVID demands we've seen not only here in Germany, but also in other countries struggling with the virus. The interdisciplinary proponents want to see a more localized approach made up of mobility control, more strategic testing and stricter quarantine rules. So in a way, leaning on the pandemic control concepts we've seen implemented in Australia and New Zealand as well. The no-COVID advocates believe the government's handling is too lax, too open-ended, and risks to alienate the public with endless shutdowns, which in their current form, they say, will never truly manage to eradicate the virus.
Now concerns about the mutant strains of the virus. How big are the fears that the new variants might lead to the situation spiraling further out of control?
Very big. The fact that these evolved strains are leading to a barely manageable spike in cases in countries like the UK and Ireland is something that is causing great concern. Just this Tuesday, it was announced that 37 cases of a new coronavirus variant had been detected in a hospital in southern Germany. New meaning that it was neither the B117 strain, which was first sequenced in the UK, nor the aggressive 501YV2 first flagged by doctors in South Africa. Now, while mutations are completely normal, worries exist regarding transmissibility, severity, and of course, efficacy of the newly developed vaccines, that beacon of hope for millions of people around the globe. The heads of the two leading vaccine developers, Pfizer and Moderna, are confident their products will work on the mutations as well, but with rollouts across Europe getting on rather slowly, the most effective protection against the new strains is and will be for some time the much loathed social distancing.
And what's the situation in other European countries?
It really is grim milestones all around. All eyes are, of course, currently on those two countries I mentioned earlier, the UK and Ireland, whose health systems have come under severe strain because of those new variants. Both countries are reporting record numbers of deaths. Same goes for Portugal, a country that did fairly well during the first wave, but has now become the European country with the highest infection rate relative to the size of its population. While many nations are still grappling with a second wave of the pandemic, Spain is already gripped by a rampant third wave, which has seen the country's COVID-19 incidence hitting new highs. The results are new restrictions, lockdowns, and curfews in many European countries, and an urgent call by the European Commission on EU governments to speed up their inoculation programs. They want to see 70% of the bloc's adult population vaccinated by the end of August. But considering that Germany managed to immunize only a bit over 1% of its population in the first month of the drive, that seems awfully optimistic at this point.
All right, Nicole, thanks so much for joining us from Berlin.